I'm Peter Block in Orlando at the annual AHA meeting for On the Scene, and with me is Dennis Coe from Canada. Dennis has looked at HDL, our friend HDL that's supposed to be good for you, and has some interesting observations from his trial. Dennis, tell me what your trial is to start with.
So we looked at HDL cholesterol levels and the relationship of HDL and outcomes in a big data approach. So we looked at 630,000 patients or individuals who had no prior cardiovascular conditions in Ontario, Canada, and we found relationship that is kind of unexpected. At that HDL cholesterol levels is related to cardiovascular mortality, but as well as cancers, as well as other cancer as well as other mortality. So I think that our really finding is that, well, it's less specific and it's more complex than we think.
Well, we as cardiologists have always been trying to raise HDL. Think of all the drugs that have tried to do that.
Yeah.
Are you now turning around saying, wait a minute, this may not be so important?
Yeah, I think that so many efforts have been tried to increase HDL, as well as Mendelian randomization study, genetic studies that show that it didn't really reduce myocardial infarction. So I think that the way that we think about HDL probably needs to be modified. So we kind of traditionally think it is related to the heart, but this is probably showing that it's more diverse. It's confounded by many things and it's related to other things else.
So a lot of other things are associated with a high or low HDL. But let me ask you one clinical question that I deal with every day, and that is, for the patient that has a very low HDL, pick a number, 36,
Sure.
and an LDL of 170 or so forth, is that still a high-risk person?
Yeah, I think so. I think the approach would be try to get the LDL as low as possible with with recent medical recommendations. I think that increasing HDL, what we show is that lower HDL has higher total mortality. While it's not specific for the heart, it's important. So we found that low HDL is related to lower socioeconomic status, poor lifestyle modification. So I think the traditional knowledge is still correct, but our data suggests that it is just not only for the heart, but it's just probably for your overall well-being.
So there you have it. HDL is still our friend. I guess we can say that, but it's certainly a much more complex issue than we initially saw. And simply having a high HDL is not going to save your life, and having a low HDL is not necessarily going to do you in. Fair enough?
I think that's quite a good summary.
So we need still to figure this one out and look harder. Thank you very much, Dennis.
Great. Thank you.